Hi everyone, this is Supriya, lecturer in biochemistry. Now I am going to explain you liver function tests and serum enzymes in liver diseases. Okay, now let us discuss about the liver function tests. Okay, first let us discuss about the bilirubin and serum bilirubin. Okay, here bilirubin is a bile pigment and is the excretory end product of heme degradation. Bilirubin is nothing but a bile pigment and it is the excretory end product of heme degradation. Okay, it is conjugated in the liver to form bilirubin diglucuronide and excreted in bile. Okay, it is present in the liver to form bilirubin diglucuronide and excreted in the bile. Okay, now let us discuss about serum bilirubin. The normal concentration of serum bilirubin is in the range of 0.2 to 1 mg per dl. Okay, normal concentration of serum bilirubin is in the range of 0.2 to 1 mg per dl. Of this, the conjugated bilirubin diglucuronide 75%, monoglucuronide 25% is 0.2 to 0.4 mg per dl, while the unconjugated bilirubin is 0.2 to 0.6 mg per dl. Okay, conjugated bilirubin వచ్చేసి 0.2 to 0.4 mg per dl. Okay, while unconjugated bilirubin వచ్చేసి 0.2 to 0.6 mg per dl. Next, coming to the point, icterus index. Okay, icterus index, that means this is the simplest test to measure the yellow color of serum due to bilirubin. Okay, it is rather crude and almost outdated. Okay, it is the simplest test to measure the yellow color of serum due to bilirubin. Okay, it is rather crude and almost outdated. However, it is often useful for a rapid assessment of neonatal jaundice. Okay, it is often useful for rapid assessment of neonatal, that means newborn babies lo jaundice ni test చేసేదన్నమాట is icterus index అనేది. Next, Vandenberg reaction. This is a specific reaction to increase in serum bilirubin. Okay, it is a specific reaction which is used to identify the increase in serum bilirubin. Okay, normal serum gives a negative Vandenberg reaction. Normal serum gives negative Vandenberg reaction. Next, coming to mechanism of the reaction. Vandenberg reagent is a mixture of equal volumes of sulfonamic acid. Vandenberg reagent ante entante it is a mixture of equal volumes of sulfonamic acid in dilute HCl, that means dilute hydrochloric acid, and sodium nitrite. Okay, principle of the reaction is that diazotized sulfonamic acid in the above mixture reacts with bilirubin to form a purple colored azobilirubin. Okay, to form purple colored azobilirubin. Next, coming to the point, direct and indirect reactions. Bilirubin as such is insoluble in water, while the conjugated bilirubin is soluble. Okay, bilirubin as such is insoluble in water, while the conjugated bilirubin is soluble. Okay, Vandenberg reagent reacts with conjugated bilirubin and gives a purple color immediately. It gives a purple color immediately. That means normally within 30 seconds. This is referred to as a direct positive Vandenberg reaction. Addition of methanol dissolves the unconjugated bilirubin, which then gives the Vandenberg reaction. Methanol add చేయటం వలన ఇది methanol add చేయటం వలన ఈ unconjugated bilirubin అనేది dissolve చేస్తుంది అన్నమాట. Addition of methanol dissolves the unconjugated bilirubin, which then gives the Vandenberg reaction normally within 30 minutes. Okay, that is positive, and this is referred to as indirect positive. Okay, ఇక్కడ చూడండి, వాండెన్బర్గ్ రియేజెంట్ కాంజుగేటెడ్ బైలిరూబిన్తో రియాక్ట్ అయ్యి పర్పుల్ కలర్ని వెంటనే ఇస్తుంది అనమాట, ఇమీడియట్గా. అంటే నార్మల్లీ విత్ ఇన్ 30 సెకండ్స్లో ఇస్తే దాన్ని డైరెక్ట్ పాజిటివ్ వాండెన్బర్గ్ రియాక్షన్ అంటాం. అదే మిథనాల్ యాడ్ చేసినప్పుడు అన్కాంజుగేటెడ్ బైలిరూబిన్ డిజాల్వ్ అయినప్పుడు వాండెన్బర్గ్ రియాక్షన్ విత్ 30 minutes అవుతుంది అనమాట, నార్మల్లీ విత్ ఇన్ 30 minutes. ఓకే, పాజిటివ్. And this is referred to as indirect positive Vandenberg reaction. Next, coming to the point, if the serum contains both unconjugated and conjugated bilirubin in high concentration. If the serum contains both unconjugated and conjugated bilirubin in high concentration, the purple color is produced immediately. Okay, if the serum contains both unconjugated conjugated bilirubin high concentrations లో ఉంటే పర్పుల్ కలర్ అనేది immediate గా ప్రొడ్యూస్ అయిపోతుంది, which is further intensified by the addition of alcohol. Okay, this type of reaction is known as biphasic reaction. Vandenberg reaction and jaundice. This reaction is highly useful in understanding the nature of jaundice. Okay, this reaction is highly useful in understanding the nature of jaundice. That is, this is due to the fact that the type of jaundice is characterized by increased serum concentration of unconjugated bilirubin, conjugated bilirubin, or both of them. Okay, this reaction is highly useful in understanding the nature of jaundice. Okay, ఈ వాండెన్బర్గ్ రియాక్షన్ అనేది highly useful. Okay, most important అని అనుకోవచ్చు. For what purpose means to understand the nature of jaundice. Okay, this is due to the fact that the type of jaundice is characterized by increased serum concentration. Okay, this is due to the fact that the type of jaundice is characterized by increased serum concentration of unconjugated bilirubin and conjugated bilirubin, or both of them. Okay, here unconjugated bilirubin means nothing but hemolytic, whereas conjugated bilirubin means obstructive. Both of them means, that means both conjugated and unconjugated means hepatic. Okay, next, coming to the point, therefore the response of Vandenberg reaction, okay, can differentiate the jaundice as follows: indirect positive, that means hemolytic jaundice, or direct positive, that is obstructive jaundice. Both of them, that means biphasic, that is nothing but hepatic jaundice anamata. Next, coming to the point, bilirubin in urine. Okay, conjugated bilirubin, that is being water soluble, is excreted in urine. This is in contrast to unconjugated bilirubin, which is not excreted. Okay, this is in contrast to unconjugated bilirubin, which is not excreted. Okay, bilirubin in urine can be detected by Fauchett's test or Mellin's test. Okay, bilirubin in urine can be detected by Fauchett's test or Mellin test. Next, coming to the point, bromosulfathalin test. Bromosulfathalin test ante, here bromosulfathalin means nothing but a dye. Okay, used to assess the excretory function of liver. Okay, it is used to assess the excretory function of liver. It is usually non-toxic compound and almost exclusively excreted by liver through bile. Okay, here bromosulfathalin is administered intravenously. Okay, this bromosulfathalin is administered intravenously, that is 5 milligrams per kg body weight, and its serum concentration is measured at 45 minutes and at 2 hours. దాని యొక్క serum concentration ఎక్కడ మెజర్ చేస్తారు? 45 minutes దగ్గరను, at 2 hours దగ్గర కూడా. Okay, in normal individuals, less than 5% of the dye is retained at the end of 45 minutes. Okay, less than 5% of the dye is retained at the end of 45 minutes. Next, any impairment in liver function causes an increased retention of the dye. Okay, any impairment in the liver function causes an increased retention of the dye. Okay, this test is quite sensitive to assess liver abnormality with particular reference to excretory function. Okay, with particular reference to excretory function. Any impairment in liver function causes an increased retention of the dye. Okay, this bromosulfathalin dye test is quite sensitive to assess liver abnormality with particular reference to excretory function. Okay, this is the overview of liver functions. Liver function tests. Okay, next coming to the point, serum enzymes which are derived from liver. Okay, let us discuss about serum enzymes which are derived from the liver. Okay, here liver cells contain several enzymes which may be released into the circulation in liver. Liver cells contain several enzymes which may be released into the circulation in liver damage. Okay, circulation in liver damage. Okay, liver cells contain several enzymes which may be released into the circulation in liver damage. Okay, measurement of selected enzymes in serum is often used to assess the liver function. Okay, measurement of selected enzymes in serum is often used to assess the liver function. It must, however, be noted that there is no single enzyme that is absolutely specific to liver alone. Okay, it must, however, be noted that there is no single enzyme that is absolutely specific to liver alone. Despite this fact, serum enzymes provide valuable information for liver function tests. Some of these enzymes are discussed here and there. Okay, measurement of selected enzymes in serum is often used to assess the liver function. Okay, actually it must be, however, be noted that there is no single enzyme that is absolutely specific to liver alone. Okay, despite this fact, serum enzymes provide valuable information for liver function tests. Okay, now let us discuss about the enzymes. Okay, transaminases or aminotransferases. Okay, here transaminases or aminotransferases means the activities of two enzymes, namely serum glutamate pyruvate transaminase, as recently called as alanine transaminase. Okay, serum glutamate pyruvate transaminase ni recently called as alanine transaminase, and serum glutamate oxaloacetate transaminase recently known as aspartate transaminase. These are widely used to assess the liver function. Okay, here alanine transaminase is a cytoplasmic enzyme, while aspartate transaminase is found in both cytoplasm and mitochondria. Okay, activity of these enzymes is low in normal serum. Actually, the activity of these enzymes is low in normal serum. Serum alanine transaminase and serum aspartate transaminase are increased in liver damage. However, alanine transaminase is more sensitive and reliable for the assessment of liver function tests. Okay, alanine transaminase is more sensitive and reliable for the assessment of liver function tests. Okay, the normal aspartate transaminase or alanine transaminase ratio is around 0.8. This ratio is increased greater than 2 in myocardial infarction, alcoholic hepatitis and cirrhosis. Okay, aspartate transaminase and alanine transaminase ratio is decreased, that is alanine transaminase higher in acute hepatocellular, okay. And next coming to the point, alkaline phosphatase. Alkaline phosphatase is mainly derived from bone and liver. Alkaline phosphate is mainly derived from bone and liver. That means the cells lining the bile canaliculi. Okay, a rise in serum alkaline phosphatase, normally 3 to 13 Ka units per dl, usually associated with elevated serum bilirubin, which is an indicator of biliary obstruction. Okay, here alkaline phosphatase is also elevated in cirrhosis of liver and hepatic tumors. Okay, cirrhosis of liver and hepatic tumors. Liver is not the sole source of alkaline phosphatase. Liver is not the sole source of alkaline phosphatase. Therefore, its measurement has to be carefully viewed before arriving at any conclusion. The liver and bone isoenzymes of alkaline phosphatase can be separated by electrophoresis. Liver and bone isoenzymes of alkaline phosphatase can be separated by electrophoresis. This is a microsomal enzyme widely distributed in body tissues, including liver. Okay, including liver. See here, this is a microsomal enzyme. This alkaline phosphatase is a microsomal enzyme which is widely distributed in body tissues, including liver. Okay, measurement of glutamyl transpeptidase. Okay, measurement of glutamyl transpeptidase activity provides a sensitive index to assess liver abnormality. Okay, this measurement of glutamyl transpeptidase activity provides a sensitive index to assess liver abnormality. The activity of this enzyme almost parallels that of transaminases in hepatic damage. Serum glutamyl transpeptidase is highly elevated in biliary obstruction and alcoholism. Okay. Further, several drugs induce and increase this enzyme in circulation. Further, several drugs induce and increase this enzyme in circulation. Next, coming to the point 5 nucleotidase. The serum activity of 5' nucleotidase, that is normal value 2 to 5 U per L, is elevated in hepatobiliary disease, and this parallels alkaline phosphatase. Okay, the serum activity of 5' nucleotidase is elevated in hepatobiliary disease. Okay, it is elevated in hepatobiliary disease, and this parallels alkaline phosphatase. The advantage with 5' nucleotidase is that it is not altered in bone disease. Okay, the main advantage with 5' nucleotide is that it is not altered in bone disease. Okay, other enzymes. Serum isocitrate dehydrogenase and isoenzymes of lactate dehydrogenase are also useful in liver function tests. Okay, serum isocitrate dehydrogenase, isoenzymes of lactate dehydrogenase kuda useful in liver function tests. Next, coming to enzyme combinations. Okay, enzyme combinations. Very often, a combination of serum enzyme estimations is used for a better understanding of liver functions. Okay, it is used for the better understanding of liver functions. For instance, a large increase in transaminases related to a small increase in alkaline phosphatase, which indicates hepatocellular damage. Okay, here, for instance, a large increase in transaminases relative to a small increase in alkaline phosphatase indicates that hepatocellular damage. On the other hand, a small increase in transaminases and a large increase of alkaline phosphatase shows biliary obstruction. Okay, small increase in transaminases and large increase of alkaline phosphatases shows biliary obstruction. Okay, this is the overview of serum enzymes. Okay, serum enzymes in liver diseases.